Welcome back to our medical simulation series. Today, we're diving into a critical post-recovery scenario, managing a patient with severe hypothermia. This is a situation where every second and every degree counts. Our team is about to run through a high-fidelity simulation, and we're taking you right into the heart of the action. So, let's get started. The scene is set. A patient has just been pulled from icy water. They're non-responsive, with a core body temperature dangerously low. The pre-hospital team did a fantastic job with initial stabilization, but now the real challenge begins in the emergency department. The team's objective is to rewarm the patient safely and effectively, avoiding the pitfalls of rewarming shock and afterdrop. As the team receives the patient, the leader immediately starts delegating roles. One nurse is on airway management, another is attaching monitoring equipment, temperature probes, and blood pressure cuffs. Notice the use of a core temperature probe, either esophageal or bladder. Surface temperature readings can be misleadingly high in these cases. The leader calls for warm for fluids. This is a cornerstone of active internal rewarming. The fluids are heated to around 40 degrees Celsius, and they're administered through large bore IVs to deliver that warmth directly to the patient's core. Simultaneously, another team member is preparing for active external rewarming. They're using a forced air warming blanket, like a bear hugger. This device blows warm air over the patient's body. The key here is to rewarm the trunk first, before the limbs. Rewarming the arms and legs too quickly can cause cold, acidic blood from the extremities to rush back to the heart. This phenomenon, known as afterdrop, can trigger life-threatening arrhythmias. That's why you see them carefully placing the blanket over the patient's chest and abdomen. The team leader is constantly communicating, asking for updates on vital signs and the core temperature. What's the latest temp? How's the heart rhythm looking? This closed-loop communication is vital to ensure everyone is on the same page. The patient's ECG shows bradycardia, a slow heart rate which is expected in severe hypothermia. The heart is essentially hibernating. The team knows not to push aggressive cardiac drugs at this stage, as a cold heart is very irritable and resistant to them. The primary treatment for this bradycardia is rewarming. Now, let's talk about a more advanced technique they're considering: extracorporeal membrane oxygenation, or ECMO. For patients in cardiac arrest due to hypothermia, or those who aren't responding to less invasive methods, ECMO can be a lifesaver. It involves draining the patient's blood, warming it outside the body, and then returning it. This is the most efficient way to rewarm a patient. The team is discussing the criteria and preparing the cardiothoracic surgery team, just in case. This shows excellent forward thinking and interdepartmental collaboration. Notice the respiratory therapist managing the ventilator. They're providing warmed, humidified oxygen. This helps to rewarm the patient from the inside out and also prevents further heat loss through breathing. Every little bit helps. The patient's blood gases are being checked frequently. Hypothermia can cause significant metabolic derangements, like acidosis, and these need to be monitored and corrected carefully as the patient rewarms. The team leader calls for a huddle. Temperature is up by 1 degree. Heart rate is slowly increasing. Let's maintain our current rewarming rate. We're aiming for about 1 to 2 degrees Celsius per hour. Too fast is just as dangerous as too slow. This controlled approach is crucial. Rapid rewarming can cause massive fluid shifts and electrolyte imbalances, leading to a condition called rewarming shock. It's a delicate balancing act. Let's pause and break down what we've seen. First, a clear leader was established who delegated tasks effectively. Second, they prioritized core rewarming using both active external and internal methods, warm for fluids and forced air blankets. Third, continuous monitoring of core temperature and cardiac rhythm was maintained. Fourth, they anticipated potential complications like afterdrop and prepared for advanced interventions like ECMO. Finally, communication was constant and clear. These are the hallmarks of an effective resuscitation. Back to the simulation. The patient's temperature is now approaching 30 degrees Celsius. As they get warmer, they might start to shiver. While shivering is the body's natural way to generate heat, it also dramatically increases oxygen consumption, which can be stressful for a recovering heart. The team is ready to manage this with sedation if needed. They are also keeping a close eye on the blood pressure. As the blood vessels dilate with rewarming, the patient can become hypotensive, so vasopressors might be required. The simulation is nearing its end. The patient's core temperature has reached the target of 35 degrees Celsius. Their heart rate is back to a normal sinus rhythm. and they're beginning to show signs of responsiveness. The team successfully navigated the complex challenges of hypothermia management. They worked together seamlessly, demonstrating not just medical knowledge, but incredible teamwork and communication skills. In the debrief that follows, the team will discuss what went well and what could be improved. What was the time to starting active rewarming? Was communication clear? Did everyone feel comfortable in their role? This process of reflection is what turns a practice scenario into a real learning experience, building muscle memory for when a real life is on the line. Managing severe hypothermia is a high-risk, low-frequency event for many clinicians, which is why this kind of regular, realistic training is so incredibly important. It ensures that when that call comes in, the team is ready to perform at their best. Thank you for joining us for this deep dive into hypothermia management. It's a testament to the dedication and skill of medical professionals everywhere. If you found this simulation breakdown helpful, be sure to like this video and subscribe to our channel for more in-depth medical scenarios. Stay safe, and we'll see you in the next one.